Good morning. This is March 26, 2024. The Insurance Committee of the Tennessee House of Representatives of the 113th General Assembly is now in session. Madam Clerk, please call the roll.
Representatives Sapicki, Davis, Freeman, Helton Haynes, Hemmer, Hicks of Hawkins, Hill, Johnson of Montgomery, Johnson of Knox, Lafferty, Mitchell, Ritchie, Rudd, Rudder, Sparks, Terry, Thompson, Vice Chairman Martin of Carroll, Chairman Kumar. Mr. Chairman, you
Here.
have a quorum.
Thank you. Members, do we have any personal orders? Vice Chair Martin, you're recognized.
Thank you, Mr. Chairman. Will y'all welcome the two most important constituents of my District 79, my wife, Krista, and our son, Steele, who's here on spring break with us today. So welcome them.
Any other? This is our last meeting, so if you have any orders, let's fill them. We do have a student from Day Spring Academy in my district, Jordan Jackson, visiting us. He's technically a shadow. Where is Jordan? Oh, there he is. Seeing no other business or no other orders, we will move on with our calendar today. We have 10 bills on the calendar. Number one is House Bill 1723. I don't see Chair Lady Hazelwood. Oh, there she is. Well, welcome, Chair Lady Hazelwood. We have a motion and a second on House Bill 1723. I have two amendments on my list. Which one are we running?
We are running drafting code 017085. This is the same amendment that was passed in subcommittee with just a technical change.
Do we still need to attach it? Yeah, okay. So I have a motion and a second on the amendment. All those in favor of attaching amendment 017085 to House Bill 1723, please say aye. Opposed? The amendment goes on the bill. Kindly explain us your amended bill.
Thank you, Mr. Chairman. This is a hospital assessment bill that we bring to you every year. This was first passed in 2010. It's a voluntary assessment by the hospitals that helps to support our TennCare program. This bill today will bring in over $3 billion into TennCare funding for Tennesseans who are covered by that Medicaid program. This year's bill, there's a couple of kind of fairly major changes in that the rate of assessment is going from 4.87% to 6%. And again, this is going to draw down state matching dollars, which will create state matching dollars, which will in turn draw down federal dollars to fund a lot of the key services and benefits for TennCare recipients. And this percent up to 6% also brings the hospital assessment in line with other provider assessments like the nursing home assessment, and ambulance assessment, and some others in Tennessee and throughout the country. The other change for this year is that this year's assessment, the 2024 assessment, will be based on cost data from the 2021 medical cost report. Again, we all know that medical costs have done nothing but continue to escalate. So this is, while it's still behind, that's the last year that we have full cost for. And so those are the two major changes. Other than that, it's the same hospital assessment bill that, again, we've been dealing with since 2010. With that, Mr. Chairman, I stand ready for any questions.
Well, thank you for that explanation. I agree, considering the cost of healthcare being what it is and the way it is rising, better funding is needed. Members, do you have any questions? Seeing none, and without objection, we are voting on House Bill 1723. All those in favor, please say aye. Opposed? Ayes prevail. The bill goes on to Finance, Ways and Means.
Thank you very much.
Thank you. Item 2 on our agenda is House Bill 2635. We have a motion and a second. Leader Camper, you're recognized. I do have an amendment.
Thank you, Mr. Chairman. Thank you, committee members. Yes, sir. The amendment drafting code is 016946.
Members, do we have a motion on the amendment? We have a motion and a second. All those in favor of attaching amendment 016946 to House Bill 2635, please say aye. Opposed? Ayes prevail. Amendment goes on the bill. Leader Camper, kindly explain us your amended bill.
Thank you, Mr. Chairman, committee. Mr. Chairman, what the amendment did was correct it changed the date to match the enacting clause. It's difficult for insurers to change benefits halfway, so what it'll do is make it effective on the first day of 2025. That's what the amendment did. What the bill does is it enables Tennesseans on TennCare to receive or obtain a 12-month supply of birth control from their health benefit plan that provides coverage for hormonal birth control. It also will make it easier for rural Tennesseans. It'll save money to the state. Largely in our rural areas, it's difficult there are deserts there for several women. So what this would do will allow them to have at least a 12-month supply of birth control. As of October 2023, nearly half our states, 24, have passed this, including Texas, Montana, Virginia, West Virginia, and many more. And so I would appreciate your favorable vote on this legislation. Thank you, Mr. Chairman and committee.
Thank you. Members, you heard the explanation. Do you have any questions? Representative Davis, you're recognized.
Thank you, Mr. Chair. And so my question is to the sponsor, if that within that 12-month period, the prescription is lost or damaged, does the insurance then pay for that new prescription or that replacement prescription?
Leader Camper.
So you're saying I have a 12-month supply, 6 months in, I lose it, can't find it. I go back to the doctor and get reissued the remaining 6 months. This just deal with prescribing for 12 months. I'm not sure how that would work, but I can get an answer for you on that.
Representative Davis.
Thank you. I appreciate that. The other question I have is actually with when it talks about in the definition of contraceptive, my concern for that is that also would include emergency contraceptive. And so a doctor could prescribe a 12-month prescription for emergency contraceptive. And I have a concern for that.
Leader Camper.
I'm sorry, Mr. Chairman. Thank you. This bill doesn't deal with that. This does not where TennCare will pay for emergency contraceptive. All I'm trying to do is say if TennCare will cover birth control pills, then they can get the prescription for 12 months. So what you're asking about is like a over-the-counter kind of measure that TennCare doesn't pay for that. That's not something TennCare does. So I don't see where this would, this bill is not addressing that issue.
Representative Davis.
And I appreciate that. There are some prescriptives, such as Ella, that are, prescription. And it just doesn't say, it just says prescription contraceptive. It doesn't say clearly that emergency prescriptive contraceptions are not allowed in this. So that's my concern for that. But I understand what you're trying to accomplish. My concern too is that within that 12-month period, if you are having any sort of affects or having adverse reactions, then that medication that has been prescribed for that full 12 years then becomes waste. So right now we have 3-month and 6-month, and I think that those are effective and efficient. With my son, with his type 1 diabetes, he has to go to his endocrinologist, periodically, obviously, to look and evaluate his numbers and how he's responding to that. And I understand that that's obviously going to be permissive with the doctor and the patient as well as to when they return. But my concern is for that, the waste. And then also, it doesn't clearly state that those emergency contraceptives are not allowed to be part of that 12-month prescription.
Leader Camper.
Thank you, Mr. Chair. This deal with refills only. It doesn't take into account the emergency contraception that you're talking about. That's not addressed in this bill. This is only if a doctor is refilling a prescription. This will allow them to do it for 12 months. It's not mandating that they do it for 12 months. It's just allowing the doctor to prescribe for 12 months, only on a refill. So I don't know of an instance where a person is getting emergency abortion or that's not addressing this bill at all. And in an emergency situation, TennCare, I don't know that TennCare even covers that. That's an over-the-counter situation. So we can talk about it, but that's really not addressed in this bill. I understand your concerns. Yeah.
I think
Mhm.
you're right in that sense. It is not for emergency use. It's continued routine prescription.
Mhm.
Representative Davis.
Thank you. I appreciate that. The thing of it is just in reading and looking at some of those, they're also used for fibroids as well. So it has multiple uses, but one of the main primary uses is for emergency contraceptive. So that's where I was just wanting to make sure that my concerns were known. So thank you. I appreciate that. And I appreciate you clarifying that it is for refill purposes. Thank you.
Thank you.
Thank you.
Chairman Spicky, you're recognized.
Thank you, Mr. Chairman. I'd like to go and ask legal a question, if that's okay. Go. I'll let
Yes,
legal
we
question.
will go out of session. Please ask your question.
Thank you, Mr. Chairman. Could legal tell us if emergency contraceptives are excluded in the bill and whether or not TennCare covers them?
Matt Mundy from legal. I don't know the extent to which TennCare covers it. In terms of what Chair Lady Davis was asking, this would not conflict with the part in Title 39 dealing with abortion. That part would remain in effect and a doctor would not be able to prescribe something that's otherwise prohibited in Title.
Follow up?
Thank you.
We will, members, while we have legal available, do you have any other questions? Seeing none, we'll go back into session. Chairman Speaker, you're recognized. Okay. Representative Johnson, you're recognized.
Thank you, Mr. Chairman. So typically women have a once-a-year appointment, right? And as my understanding, I'm not sure, but I'm pretty sure this is correct, that over 50% of the counties in our state don't have an OBGYN. So part of the reason that we need this is so they can have that prescription that's going to last a year, because typically you don't see your OBGYN every 3 months or every 6 months. And, perhaps you might get them from your regular physician, but it ensures that women get that yearly appointment. Is that
Leader Camper.
Thank you, Mr. Chair. Yes, you're correct.
okay? And I guess also just to make clear about the emergency pill that this does not cover, that prevents implantation. It does not do anything about stopping an embryo. It just prevents implantation.
Leader Camper.
That's,
Thank you.
thank you.
Any other questions? Seeing none, are we ready for the question? We are voting on House Bill 2635. All those in favor, please say aye.
Aye.
Opposed? Kindly record that with the clerk. The ayes prevail. The bill goes on to calendar and rules.
Thank you, Mr. Chairman.
Thank you. Item 3 on our agenda is House Bill 2010 by Chairman Vaughn. We have a motion and a second. And we have a number of amendments.
Yes, sir. Mr. Chairman, the amendment that we'd like to put on, if we could, is drafting code 17302.
We have a motion and a second for Amendment 017302 attaching to House Bill 2010. All those in favor, please say aye. Opposed? Amendment goes on the bill. Chairman Wan, tell us about your amended bill.
Thank you, Mr. Chairman. And when we first conceived of this bill, it was in an effort to bring about a little bit of transparency and pricing options for people, particularly local government entities in a variety of different markets. As things do sometimes up here, issues get confused, sources are questioned, and frankly, I'm not an insurance guy. So what we decided to do was what would be best in this case was let's get a baseline for what this marketplace looks like. That way you don't have to depend on one side or the other bringing forward facts that if we ask the state comptroller to issue a report with regards to what the local government entity insurance markets look like, who's in those spaces, the solvency of such firms, then that would bring us a good place that we can find out how we can best address, or if it even needs addressing as we move into the future. And so that's what this does, is we went from basically the Magna Carta of insurance reform to a study by the comptroller. So that's what we bring to you today.
Members, do you have any questions? No, thank you. We really appreciate. I think we are here to legislate, but at the same time, it is part of legislation that we listen to our members and their constituents. And you have set an example. Thank you.
Thank you, sir.
So we are voting on House Bill 2010. All those in favor, please say aye. Opposed? Ayes prevail. Kindly record your no separately, and the bill goes on to calendar and rules. Thank you.
Thank you, Chairman and committee, except for one.
Item 4 on our agenda is House Bill 2170. We have a motion and a second. Chairman Williams, you're recognized.
Thank you, Chairman and members. I have an amendment that I'd like to put on as well. Drafting code of that amendment is 015555.
We have a motion and a second for Amendment 015555 attaching to House Bill 2170. All those in favor, please say aye. Opposed? Amendment goes on the bill. Kindly tell us about your amended bill.
Thank you, Chairman and members. This bill is a patient-centered bill. As this body knows, several years ago, we passed a bill which would create a ban on accumulator adjustment programs, which would prevent insurers from taking the credits on copays for their pharmaceuticals and prevent them from being applied to those deductibles. Since that time, though, we have found that there has been a loophole created by alternative funding programs, which allow insurance companies to use a third party, of which now patients can't take credit towards their out-of-pocket expenses on those discounts, therefore causing their cost of healthcare to rise over time. This bill would prevent those AFPs from being able to do this so that the credit goes to the patient and their money goes further. I'm happy to answer any of the questions members might have regarding the bill, but I understand there may be several people that want to testify, so they may answer their questions.
That is true, unless there's a pressing issue that we want to know right now. Let us go out of session, listen to, we have 4 people on the list to testify, and then we can filter the questions down. Without objection, we're going out of session. The first person on our list is Mr. Scott Woods. Mr. Woods, be sure your mic is on. There is a red light that comes on. And for the record, identify yourselves, and you have 3 minutes.
Great. Thank you, Mr. Chairman. And good morning, members of the committee. My name is Scott Woods. I'm a Vice President of Policy and Research at Pharma, and I'm pleased to voice our support of House Bill 2170. As Representative Williams said, in 2021, the General Assembly passed a bill that drew a line in the sand and said that Tennessee patients that are using cost-sharing assistance from manufacturers or other sources should have that assistance counted toward their deductibles and maximum out-of-pocket. But unfortunately, what we've seen in the marketplace is that there have been several different schemes that have popped up. They're called copay maximizers or alternative funding programs and others that have found loopholes in federal law to get around the intent of what the General Assembly passed years ago. House Bill 2170, again, would shut these programs down and prevent the legislative whack-a-mole, you guys having to come back session after session and having to find fixes so that patients aren't harmed in the marketplace. One example of a harmful such program is called Prudent RX. It's affiliated with CVS Health. And basically what happens is that Prudent RX tells patients that are enrolled in a drug benefit program that's administered by CVS that they have to enroll into this program and that they will then apply whatever manufacturer assistance might be available and that manufacturer assistance is, again, not counted toward their deductible or maximum out-of-pocket, or they're going to have to pay 30% coinsurance. And that 30% is based off the undiscounted price of a medicine. So this is very, very expensive. And just to give you a real crystal clear example, there are 198 medicines that treat cancer on Prudent RX's drug list. And so a cancer patient that's going to have to see their physician perhaps several times over the course of the year, or perhaps unfortunately go into the hospital, they're going to be not able to afford perhaps those costs because they haven't met their deductible or maximum out of pocket because they are using cost sharing assistance. So bottom line, House Bill 2170 would be important legislation that will protect hardworking Tennesseans, who are just trying to afford their health care by counting the cost sharing assistance that they use toward their deductible and maximum out of pocket. Thank you, and I'm happy to answer any questions.
Thank you. Members, do we have any questions for Mr. Woods? Well, thank you for coming.
Thank
We
you, Mr.
appreciate your
Chairman.
testimony. Next on our list is Ms. Mandy Young. She's here. Thank you for coming, Ms. Young. You know the routine, and
Yes, sir.
you have 3 minutes.
Thank you. Mr. Chairman and members of the committee, my name is Mandy Young, and I represent CVS Caremark. Mr. Wood mentioned AFPs, which are alternative funding plans, and I want to make it very clear that CVS does not have an alternative funding plan, and Prudent RX, our partner, which is a separate entity from Caremark CVS, is a partner but is not an AFP. It is not an alternative funding plan. Prudent RX works with our payers, our employers, and their plans to sign up individuals for the manufactured assistance programs that Mr. Wood talked about. What you need to understand is if you don't know about that plan, then you can't access that very helpful coupon. So Prudent RX's goal is to sign you up for that plan. When Prudent RX does that, Mr. Wood believes that we are a maximizer or an alternative funding plan. The employer switches all of the copays to 30% on every drug. But if you sign up for Prudent RX through CVS and their client, then you get a 0 copay on every drug. Now that is a huge cost savings. These manufactured coupons and assistance programs are meant to get around PBMs and health insurers, copays and deductibles. So they are meant to be covering those costs for insured patients. So we are not a maximizer and we are not an AFP. In 2023, we saved consumers $116 million. And we saved our employers money through Prudent RX. Cancer drugs are typically, Mr. Wood mentioned those and the hundreds that are on Prudent RX. Those are typically run through your medical plan because you are getting medical coverage for your cancer treatments. And in addition, I want to mention that our goal is to keep drugs affordable for our insureds. That's the whole goal. If they can't access those medicines because the price is so high, then they can't be cured. The average median specialty drug that was introduced and approved by the FDA in 2023 cost $300,000. So any consumer, any plan, any employer would have difficulty covering those costs. I want to make sure that some of you received information from a constituent potentially for you about her son, and said that Prudent RX did not cover the drugs. That gentleman lives in Ohio. That gentleman wasn't signed up for Prudent RX until March. We backdated it to January. But the reason he couldn't get his drugs during that time frame is because his copay assistance programs were down due to the hack with Change Healthcare. It was not a Prudent RX problem. It was not a CVS problem. And it was not any problem that we were trying to deny meds or not help that gentleman access his very expensive drugs. In addition, a lot of groups like the Hemophiliac Association are against us on this issue, and with Representative Williams. I want to explain something. We help many families every day get access to their hemophiliac drugs with the help of the coupon assistance or not, because that is what we cover. So when pharma comes to you and says that we're trying to stop people from getting access, that we're trying to help people get more access to the very program that Representative Williams is trying to save the consumer money. I'm happy to answer any questions.
Thank you. Chairman Spicky, you're recognized.
And thank you, Mr. Chairman. And by no means am I an expert in this. And this is one of the most confusing bills I've ever seen. It is so confusing. I'm still trying to figure out what we're trying to stop or what we're trying to help, because we're using so many acronyms and things. I can't figure this out. So we were in education. I could give you chapter and verse. So you got to bear with me here because I'm trying to figure this thing out. What are you, your position is against this bill, I assume, is that correct?
Yes, sir.
You're recognized.
Thank you. What are you trying to prevent?
Ms. Young.
Alternative funding plans, which is the program that Representative Williams started with, are plans that tend to kick a drug off a formulary. And once they kick that drug off the formulary, the employer, through the plan, helps that individual get on a copay assistance program because they're uninsured. And then they can access the money. What I'm trying to prevent is that the Prudent RX plan that partners with CVS, Caremark, does not kick a drug off a formulary. You have full access to every drug on the formulary. What we're trying to do is help sign up a insured for one of these copay assistance programs. The way the bill is written, it will ban our program under the swath of trying to ban alternative funding plans. Our program doesn't kick a drug off the formulary. It doesn't try to make somebody look uninsured. It follows the rules of the manufacturer's assistance program and helps your constituents who don't know they're available for a coupon to sign up. Why would you want to prevent a program like that?
Chairman Spicky.
Okay, so doesn't the pharmaceuticals have coupons? And you both have coupons. So if you both have coupons, am I misinterpreting that somewhere?
Ms. Young.
Yes, sir. We do not have coupons. PBMs do not have coupons. We negotiate a discount if there is a competitive drug with pharma, but all of these drugs typically are specialty drugs. Pharma has coupons on over 85% of their specialty drugs. Okay? We don't have coupons. They do, and we help access our insureds once an employer signs up for Prudent RX to those coupons.
Chairman Spicky.
And Mr. Chairman, you can cut me off whenever you want. That's fine. So does pharma use the coupons to help an individual meet their copay so that once the copay is met, then the future drugs could be billed directly to the insurance company. Is that the premise behind the coupons?
Yes, that's the very premise behind the coupons. And in fact, with Prudent RX, the consumers never have a copay. When they join the program for Prudent RX and partner with our PBM, their copay for the entire year that they have Prudent RX is zero. It's zero. So even when the coupon runs out, if they guess the deductible wrong on the $200,000 gene therapy or the $2 million gene therapy or the $200,000 hemophiliac drug, if they guess it wrong, then the consumer, after the coupon runs out, has exposure. Not with our program. It's a zero copay for the entire plan year. So we're helping our insureds through Prudent RX get these drugs at zero copay for an entire year.
Well, you seem to be thinking.
If someone else wants to go, I'll just come
Yeah,
back to
we'll
Mr.
come
Chairman.
back to you if you have completed your process. Chairlady Rudder, you recognize.
Has been stated here this morning, we passed legislation a couple of years ago that did require patient assistance and coupons to be applied to the patient's deductible and out-of-pocket maximums. I would just like to ask you, does Prudent RX program apply a patient assistance and coupons to deductibles and out-of-pockets cost of the patients in Tennessee?
Ms. Young?
Thank you for the question, Representative Rudder. Until recently, we could not apply the program, the coupon. Prudent RX is not ours. So the copay accumulator, CVS follows that and would count that towards that, yes. And the new program that partners with Prudent and CVS can do that in Tennessee under the True Accumulator program that we have.
Chairlady Rudder? Chairman Lafferty, you recognize.
Thank you, Mr. Chairman. And first, I'll just reiterate what my colleague here said. This is probably one of the more confusing bills I've seen in the time that I've been here. You mentioned earlier in your comments that the cancer drugs are covered under a medical plan, which is separate from a drug plan. So how would those cancer drugs be affected by this bill, or would they?
Representative Lafferty, I didn't ask that specific question since I only brushed up on this issue or learned it in the last 3 weeks. But I will tell you that if it's an intravenous drug, it is through the medical plan. And I don't know if Prudent RX, because I don't represent Prudent RX, I don't know if they can get discounts for those IV drugs for the cancer patient on the medical plan, because most of the coupons that I'm aware of run on the pharmacy plan and the PBM side.
Chairman Lafferty?
When did Prudent, when did Prudent come into being a business entity? How long have they been around?
Representative Lafferty, I don't represent Prudent RX, so I don't know the answer to that question. We have only partnered with them, I believe, a short period of time.
Okay. I'm done. Thank you.
Thank you. Representative Freeman, you recognize.
Thank you, Mr. Chairman. And I just want to clarify something, as having recently gone through a cancer scare. There are two different types of drugs that are given. One is an intravenous that is covered under healthcare, but then there are also drugs that are covered under pharmacy, and those are continuing. So just to clarify to the committee, there are absolutely two separate paths that are both part of the care of the patient. So anyway, the question I have for you is, you keep saying that Prudent RX wouldn't be able to offer. My understanding, and maybe we need to ask legal, my understanding of what this bill is doing is it's not allowing a group to kick a drug off the formulary to make it so that they can then apply for the discounts. And I'm not sure how what you're saying about Prudent RX is, if you're not changing the formulary, which is what I feel like this bill is addressing, why is it going to not allow your group to operate, or the group that you are associated with?
Ms. Young?
Representative Freeman, that's a very good question, and you are correct. There are oral medications, and that would be covered under the PBM program about the cancer drugs. So thank you for correcting me on that. As it relates to this bill, It applies to a broader group for anyone that signs someone up for one of those assistance plans. It doesn't limit the amendment to only, and I'm happy to debate which section you might be reading because I want to make sure I'm answering your question, but it won't let us sign somebody up to do that because we're changing the copay. If you sign up for Prudent RX, your copay automatically goes to zero. So we are changing the plan for the employer,
Okay.
switches for everybody to a 30% copay. And if you sign up for Prudent RX, then that individual gets a zero copay. So the plan changed. It didn't kick a drug off, but it did change the copays and to 30%. Typically, a lot of the drug plans might have a $50 copay for generic or a $0 copay for generic, and then go up in tiers all the way up to a specialty drug. And those could be a $1,000 copay, $2,000 copay, whatever it is. What they do is they switch it so it's a 30% copay on all specialty drugs.
Good.
So we are covered by the legislation.
Okay. All right. Thank you.
Any follow-up, Dr.? Chairman Hill, you're recognized.
Thank you, Mr. Chairman. And just as a follow-up to Chair Lady Rudder's question, and I guess I'm a little bit on the confused side and hoping that you can help clarify. On the CVS website, under quite a bit of explanation, and we may just need a point of clarification from you and Prudent RX from that perspective. But under specialty medications, it says, and I'm reading from the CVS website, says for any such specialty medication where third-party co-payment assistance is used, the member shall not receive credit toward their maximum out-of-pocket or deductible for any co-payment or co-insurance amounts that are applied to a manufacturer coupon rebate. And so you shared earlier that the accumulator adjustment, which is something that was passed a couple of years ago, and unfortunately I was not here for that, but you shared that Prudent RX was not in compliance at one point, is in compliance now. And so I guess I'm just asking for a little bit of clarification because that's, again, off of CVS's website.
Yes, sir.
And that is, it appears to be not in compliance with the law that was passed. Could you just speak to that for a second?
Yes, Ms. Young.
That's a general statement, Representative Hill, and thank you for that question. I think what really matters for all of you is we offer the zero copay, and we will comply with the copay accumulator law. But what you need to know is the reason the copay accumulator law was passed by PhRMA several years ago was to make sure that once you used the coupons, you met your deductible. Okay? Once you used your coupons, you met your deductible. All right? Well, you don't have that problem under the Prudent RX because your deductible is zero. All right? And zero means you're going to get your drugs under that program. Now, it is my understanding, Representative Hill, that we studied up on Prudent RX, that we are going to be able, with True Accumulator, for instance, the state doesn't use True Accumulator, doesn't use Prudent RX, but if it did, it would want us to apply that coupon value to follow the law. So we would have to work that out with the state. And I was told last week by my client, Caremark, that we have worked out that something that's the state could use, and it would save them substantial money if you didn't pass this bill.
Okay. Thank you. Thank you, Chairman.
Thank you. Representative Hemmer, you recognize.
Thank you, Mr. Chairman. Ms. Young, if your client is, or Prudent RX, excuse me, is not a maximizer or an AFP, what do they call themselves?
You recognize.
Representative Hemmer, my client is CVS Caremark, and we are affiliated. We have a partnership with Prudent RX. We do not own them. So I don't know what they're called. I think they would tell you they're helping people access manufacturer coupons. And they have a contract not with us, but with the employer that we send them that's our client.
You recognize.
They may have a contract with us, but they have an employer directly with contract directly with the employer.
Second question is around, is there a way that the pharmaceutical companies can without this legislation wasn't needed, could they just do their own terms and conditions, not work with an accumulator or an AFP?
Ms. Young?
Representative Hemmer, yes, sir, they could change their rules, but I think they also don't want to change their rules because they want to help the average consumer that's not signed up for Prudent RX get around their deductible and copay, which is meant to drive you to lower cost drugs. They want to help the consumer get around that so they have someone using that specialty drug or that brand name drug for long term. So Prudent RX figured that out, I guess, and figured out a way to help save employers and insureds money to do that. And I also want to mention to you that no state in the country has passed this bill yet. Back to Representative Lafferty's question and everybody's confusion, the reason no state in the country has passed this bill yet is because it is confusing. And we don't set the price for drug, pharma sets the price for drugs.
Paula? Just to clarify things, and we have talked about it before. So Prudent RX is an independent entity. You're not affiliated with them, and they are not affiliated with an insurance company that the patient is accessing their healthcare through. Is that true?
Chairman Kumar, Prudent RX is contracted with CVS Caremark. It is not owned by CVS Caremark. It is not an affiliate of CVS Caremark. It is a contracted party, both with our employers and us.
So if I have insurance and I need to fill up a prescription, I can go to CVS or the pharmacy that I choose, and the pharmacy, I would pay copay, and pharmacy will bill my insurer for the rest. So far, true?
True, yes, sir.
Okay. And then I have an option to signing up with, say, Prudent Healthcare that is basically intervening and says that I can purchase my medications through them without copay. That is true.
It's partially true, Chairman Kumar. Typically, these are not going to be drugs that are signed up that you go pick up at your pharmacy. These are typically higher priced specialty drugs. It's not a good RX program.
Right.
Like you might be referring to, that may help you pay less at the register when you pick it up from your pharmacy. Your plan has to offer it to you, and then you have to sign up with Prudent RX.
So if I sign up with Prudent and I get my medications through you, having signed up with Prudent, how does Prudent make money?
Again, Dr. Kumar, I don't represent Prudent. I have asked my client that question, and they charge a fee to the employers that they help save money for. So there's a fee there. And beyond that, I don't know the other ways they make money. Since I don't represent them, I can't ask them questions.
So they charge a fee to the employer, did you say?
Yes, sir.
That would be my employer if I'm the patient filling a prescription?
Yes, sir.
And is my employer signed up with them? Are they obliged to honor their fees?
It's a choice of the employer to sign up. It is not, and the state of Tennessee has not signed up because we couldn't offer it to them until recently. So no, they have not signed up.
So I will know that my employer has signed up with Prudent, or Prudent will not accept me unless my employer has signed up with them.
That's correct. I don't know if they offer a general opportunity to sign up to anyone to Prudent RX, but if you are on a medication and you are a savvy consumer, which not everybody is, they would know to Google the drug and see if there's a manufacturer's coupon from any of my many friends in pharma who are filling up the room behind me. So if you are a savvy consumer and you know how to do that, then you may be able to find the coupon anyway, but it wouldn't get you a zero copay. If you sign up with the manufacturer's coupon, it will only last for a period of time, and then it runs out, and then you have exposure as a consumer.
Tough being savvy in today's market. We'll move on. Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. So, Ms. Young, would this would only apply to ERISA plans, correct?
Ms. Young.
Representative Mitchell, I don't, Prudent RX can offer it to fully insured plans as well through the insurance company or the PBM, I believe. But AFPs, alternative funding plans, are typically only offered to ERISA plans.
Okay, so Prudent RX, you say, so if I'm a third-party administrator and I have a client and we install Prudent RX in the plan, and that client is going to be paying a PPM per month per enrolled employee for the savings. Are all drugs on the formulary included, or are we just narrowing down the expensive drugs?
Ms. Young?
Representative Mitchell, Prudent RX can only offer the manufacturer coupons on the drugs that the manufacturers are offering. So you would not only have Prudent RX as a partner to that employer, but you would also have a PBM that is still part of it. Prudent RX is not the pharmacy benefit manager, does not run the claims through the system. That is still done through CVS Caremark if we are your PBM. We have a special arrangement with Prudent RX. I don't know what Prudent RX does with its other clients.
You follow?
Yeah, thank you, Mr. Chair. So I'm just saying, CVS Caremark seems to have the contract with the state of Delaware in which they've contracted with Prudent RX, and it only covers rheumatoid arthritis, multiple sclerosis, and cancer drugs. And of course, those are the 3 drugs that are, and along with hemophilia and hepatitis, are the 5 categories of drugs that blow up a self-funded plan. So it looks like they can narrow it down, and that's why I'm trying to determine if they're an AFP or not.
Okay.
So what would you say determines between if Prudent RX, if CVS is looking at them, what would CVS determine is an AFP and what is not?
As Google is how I learned about AFPs when this bill came out. Google will tell you that alternative funding plans kick drugs off formularies to make that patient uninsured for that one drug. Prudent RX merely helps any of its members through a program join the manufactured assistance program by asking the appropriate questions on the website.
You're right. Sure. Alternative funding plan. No, it's important to understand. Representative Mitchell, you recognize.
Yeah, so that's why I'm confused because, in Delaware, it looks like they've kicked off everything off the formulary except these 3 types of drugs.
Ms. Young?
Representative Mitchell, when Prudent RX lists the drugs in which it can help you with, they're only getting the manufactured coupons on that. That does not mean those drugs are not covered by the Delaware plan or Caremark CVS.
Right.
So I want to make clear, I don't know what's in the Delaware plan, and I don't know if Delaware has a copay accumulator law.
The copay is 0, just like you said, for all the
Right.
folks there. So
Right. But
And-
it doesn't kick off. I'm sorry.
All right. Can we move on?
I'm good. Thank you.
Thank you. You're welcome. Representative Johnson, in interest of time, members, let us be concise and exact.
I just have one question. Is anybody from Prudent here? Seems to be a lot of questions for them.
They have not registered to speak to us. Representative Ritchie, you recognize?
Thank you, Chairman. Thank you, Ms. Young, for being here. Right before Chairman Spicki had asked AFPs, I Googled since you kept using the word. And it says alternative funding programs are an emerging business model that threatens to dismantle the promise of comprehensive drug coverage for many Americans if left unabated. AFPs are operated by a third party that exploits a loophole in offerings of charitable organizations and patient assistance programs. I guess the question that I end up having is when we end up looking at this right here and it hasn't been addressed anywhere else, maybe that's a good thing that we're taking a look at it. But when we end up digging into it, the overall, and this might be more of a question on prudent side and with them not being here, is with those particular contracts, is I guess trying to understand where that particular loophole and where the funding's coming. So they go to the employer, contract with the employer, whether it's self-insured or it could end up being to reduce some of the mitigation off the group benefit plan that's there. What are the other, I guess, contract portions that's coming back from Prudent and with Pharma? And it might be a question for Mr. Woods on there, how that's taken place.
Ms. Young?
Representative Ritchie, alternative funding plans to that very point makes the individual look uninsured if they have the $2 million drug that they have to get, so that the plan doesn't have to pay for the $2 million drug every month. Prudent RX merely helps the manufacturer's coupon get to that person because they didn't sign up for it. So Prudent RX signs you up. There's no kicking a drug off formulary. There's no attempt to make you look uninsured. There's helping your consumers and constituents save money for them and for their employer to save money. And then CVS covers the drug if it's on the formulary. There's no sham for that. What I'd like to also mention is coupons and copay assistance are available for all of your constituents today, every one of them. But they've got to know they exist. And what happens is most constituents do not. So that is what Prudent RX has figured out how to do, which is to help access those manufactured coupons. It's not a loophole if the manufacturer offers the coupons to anyone that's insured to get around their copay and deductible. It's the same thing Prudent RX is doing. It's helping you sign up to get the savings, and then CVS, in exchange for you signing up for Prudent RX, gives you a zero copay for the entire year. Hope that answered your question.
Members, do we have any other question for Ms. Young? Chairman Speaker?
So let's circle back to the bill. Is this an accurate statement? Currently, Pharma can offer these coupons to individuals to get these very expensive drugs that in theory could be used for their copay so that they can continue after that to get these expensive drugs for their ailment. Currently, the people that you're representing has a third party that finds these coupons for individuals to get them so that they can get these discounts, so we have Pharma offering the coupons to help the patient, and your group is in a position right now to help individuals who don't know the coupons exist find the coupons. So in the bill, if I understand this right, we're taking your ability to help people find the coupons out and just leaving this with the goodwill of Pharma to initiate these coupons to the individuals if they so find them. Is that
Ms.
where we
Young?
are?
Yes, Representative Sapicki, because we will no longer be able to sign them up and change our plan to give them a zero copay when they sign up for Prudent RX today. So they're going to ban us from using a Prudent RX to get a $0 copay and hope that the consumer finds the coupon.
Chairman Speaker?
We have two more people to testify, Mr. Chairman.
Yes, we do. Ms. Young, thank you.
Thank you.
The next, members, if you're ready, the next person on our list is Ms. Martha Gentry.
Thank you, ladies and gentlemen. Thank you for your attention to the questions and answers. I represent Cigna. Cigna is a global healthcare company. We insure on the health side 600,000 Tennesseans. On the PBM side, we have over 1 million members. We contract in Tennessee with 2,500 retail pharmacies and 23 specialty pharmacies. We operate a program that's very similar to Prudent RX called Save on SP. So I don't have a lot to add in terms of the nature of our program because it's very similar to Prudent RX. I just want to emphasize a couple of points. Pharma chooses to use coupons, and coupons drive brand loyalty. And we've talked about that a little bit because a patient needs a medication, the doctor prescribes a particular expensive specialty drug because it has a coupon. And without these additional programs, when that coupon runs out, then they are on the hook for the additional cost of the expensive drug. I'll use a personal example. Prescription for a blood thinner coupon, it was $50 for the first 3 months. After the coupon ran out, it was $200 that was out of my pocket. Pharma, when they bring drugs to the market and put them out for patients to use, they're setting that retail price. Those retail prices can change year to year. Because of the expensive prices of specialty drugs, and I'll reiterate that in the overall global market, 2% of patients are using specialty drugs, but they take up 51% of the total drug spend by PBMs and patients. 80% of the specialty drugs to market are using these coupons to drive brand loyalty. That brand loyalty takes away insurance companies and PBMs' ability to help their members use evidence-based programs that might find lower costs, generics, biosimilars, alternative drugs. So those are some of the reasons that we oppose it. The coupons are steering patients to use these new brand drugs, while we are not able as a PBM to steer patients to help them find lower cost alternatives. So on the Save SP program, the employer groups that are using that with us are saving between $450 and $650 per member per month on their premium spend. And as a employee, that amount would translate into about $78 in real premium costs to that employee every year. So that is your constituent saving real premium dollars. And it's the premium dollars that our Tennesseans, employees, your constituents, the premium dollars is what's paying for these drugs. And all we're trying to do by using PBMs and these programs such as Save on SP is help Tennesseans afford their drugs the most effective way possible.
Well, thank you, Ms. Gentry. Members, do we have any questions? Chairman Lafferty, you're recognized.
Thank you, Chairman. You mentioned a minute ago saving, the dollars you mentioned saving on premiums. Are you talking about the premiums on the medical policy? Or are you talking about the premiums on the drug policy? Or are you talking about the combination of the two?
Ms. Gentry?
Thank you, sir. Typically, an employer has a contract for insurance that includes a drug plan. So it would really be a combination of the two.
Okay. Thank you. Thank you, Chair.
Chairman Spicky?
And thank you for testifying. If I understand what you're saying is you have a similar program to the previous person who just testified. So does your group, organization, are you out there trying to find these coupons for your individuals too? And do you use those for their copay, or do you have a zero copay like the other testimony was?
Ms. Gentry?
Thank you. Thank you for the question. I am not as versed in the particulars of the Save on SP as much as Ms. Young was with Prudent RX. It's a separate company that works with the employer to help them afford specialty drugs, but the specifics on how they go about it, I'm sorry, I can't answer that.
Thank you, Mr. Chairman.
Seeing no other questions, thank you for coming. Members, we do have one more person on our list, Miss Megan Crow. Please be sure your mic is on, identify yourself and who you are with.
My name is Megan Crow. I'm with the Tennessee Hemophilia and Bleeding Disorders Foundation. Thank you for having me today. I come to you as a mother of a child with a hereditary chronic lifelong disorder that requires specialty medications that has no generic alternative. My son has severe factor VIII deficiency, otherwise known as hemophilia. This means that his blood will not clot without a medication that has and he would be faced without this medication, he would be faced with life-threatening internal bleeds that can occur spontaneously and without cause. My father also suffered from the same disorder, but he did not survive past the age of 41. Over the past decade, treatment options for those with bleeding disorders has grown tremendously and allowed for a better quality of life. But the access to those medications does not come easy. Just last year, my son was faced with multiple bleeding episodes during a 2-month period where we were going through denials and appeals for a medication that he had already been using successfully for a year. Plans will make formulary changes to save money, which puts the patient at risk and has to go through these denials and these appeals processes that can take months. The delay in the approval process for us delayed his dose change and left him with internal bleeding. High deductible plans, high premiums, and unattainable out-of-pocket maximums have made it extremely difficult for patients to pay for their health care. I want to emphasize the word health care. This includes medications and all other aspects of a patient's care. When the money that should count towards our insurance and PBM plan is strategically shifted behind the scenes and paid for, but then does not count towards our deductible and out-of-pocket costs, this means that our healthcare as a whole now suffers and it becomes unaffordable, especially for those with multiple chronic illnesses or for a family with multiple children with the same hereditary disorder. You passed this bill in 2021 that said any monies paid by the enrollee or on behalf of the enrollee will count towards a patient's deductible and out-of-pocket expenses. You decided that Tennessee would not allow copay accumulators. House Bill 2170 is now back to address the loopholes that have allowed these plans in different forms. Copay maximizers, optimizers, AFPs, or third-party vendors who claim to only benefit the patient are in fact just trying to find ways to increase their profit, even if it means hurting the patient in the process. I know my story is not just about one person's struggle. I have heard multiple accounts of people who have had experience with Prudent RX in which they were forced into this program, even when they had been obtaining their copay assistance on their own for years without a problem, and that money counted towards their deductible and out-of-pocket cost on their own. They were threatened with a $30% coinsurance if they did not sign up for Prudent RX, would have to pay thousands out of pocket, and in turn, none of that copay card would then now count towards their out-of-pocket expenses. And my personal research, Prudent RX calls themselves an optimizer program, which by definition increases specialty drug copays to the value of the manufacturer program. So whatever category they want to put themselves into, they are making it more difficult for the most vulnerable patients to afford their health care as a whole. And that copay assistance is not counting towards the deductible. And to give an example, I use manufacturer copay assistance. I only need about $2,000 a year to help meet my deductible. But the plan, an optimizer or maximizer, is instead of just taking that $2,000 from the manufacturer copay assistance, they are changing it and increasing it to the $20,000 that they can get from the manufacturer. And that is what Prudent RX is doing. They are an optimizer program. This company may be giving you pause in passing this bill who is not even here to represent themselves, but they prey on those with chronic illnesses who need specialty medications. They are not saving the patient money. It's the manufacturer copay assistance that's saving the patient all of that money. And they take a 25% cut in the process and turn the patient's plan into an accumulator plan.
Ms. Crow, thank you.
Thank you.
Do you need to finish your last thought or are you okay?
No, that's fine.
Okay. Members, do we have any questions? Representative Davis, you're recognized.
I just wanted to say thank you for being here today. I appreciate you being vulnerable with us and sharing your story with us. How long has your son been chronically ill?
He's 12, so at birth. So we've been infusing twice a week intravenously since he was able to walk.
And has the medication helped him? And have you seen improvements with him?
Yes, absolutely. He can live an almost normal life when my father, like I said, died but by the time he was 41 from the same illness.
Representative Davis.
So uh, obviously drugs have improved over time. So have you had to change medications and have you seen the cost of those increase, decrease over time as well?
Ms. Crow.
Medications have drastically changed. Instead of infusing every other day, intravenously again, there's extended half-life products that he only has to infuse twice a week, and there's some that are once a week. So the treatments have drastically changed to where patients can lead a mostly normal life if they have access to these medications.
Thank you very much.
Chairman Speaker, you're recognized.
Thank you for testifying today. You are precisely the person I wanted to talk to. All right, so your son was sick.
Mm-hmm.
How did you find the coupons?
Ms. Crow.
Thank you for asking. I wanted to say that we do not need help signing up for manufacturer copay coupons. We don't need somebody in the middle helping us with this. The manufacturer will reach out to us, will reach out to the patient and offer this to the patient. You don't have to be savvy and you don't have to know the system. They will reach out to you and offer the coupon.
Chairman Speaker.
So how did the manufacturer know to call you?
I couldn't tell you that. I mean, in my world of hemophilia, where we're all very close and we work together a lot and we work together with manufacturers. There's programs and outreach and things that we can do that either specialty pharmacy or manufacturers, they will, sponsor some of the events. And so a lot of times the contact information is shared with those events, not only if the patient wants to share that information with the specialty pharmacy or the manufacturer.
Follow up, Mr. Chairman Speaker.
No.
Chairman Martin, you're recognized. That has been answered. Very well, members. Any other questions? Seeing none. Ms. Crow, thank you very much for sharing your
Thank you.
personal story. It means a lot to us and we learned a lot. Thank you. Member, considering that is all our testimony, we'll go back into the session. And
Williams.
Chairman Williams.
Thank you. Thank you, Chairman. Thank you, members. Simply put, there are a lot of acronyms being thrown around. This body in the past has done a phenomenal job trying to seek the needs and meet the needs of patients as it relates to those that are chronically ill. In most cases, the people that we're talking about today are constituents of ours who are chronically ill, who desperately need some sort of value, any kind of value they can find for their households as it relates to paying for their healthcare costs. All this bill simply does, since we made a change in 2021, we move one piece on the chessboard and another piece moves. These did not exist prior to making that change. And I think it's interesting to see that we do have patients who come to us, our constituents who come to us and tell us that this new loophole is impugning their ability to provide for their families as it relates to their health care costs. All this bill simply does is allow those coupons to be applied to their maximum out-of-pocket deductible, which in turn helps that patient better afford their health care and fully utilize the insurance services that they purchased, either independently or through their employer. I'm happy to answer any questions.
Representative Ritchie, you're recognized.
Thank you, Chairman, and thank you, sponsor, for the bill. Question I've got, so after the testimony and the conversation, we've got coupons coming from pharma, and whether it's going directly to the recipient or whoever's going to end up needing the medication or the prescription. And then there's these AFPs or other avenues that are now going out and finding that information and then trying to contract out with whoever the particular patient is. I see what the intent is, completely understand it a lot better now. Would it end up making sense to have a consolidated list? I know that last lady that testified stated that pharma reached out to her for them to be able to come on board. Is there a consolidated list of all of these different pharma coupons that are available out there for these patients to be able to find that? Because then it would completely remove the ability of the AFPs to begin with. Is that correct?
Chairman Williams?
Thank you. Representative Ritchie, that's a really good question. I'm unaware of any comprehensive list. I do think what happens much like all of us, when we have an issue related to our health or our children's health, and we go to our medical practitioner and then they suggest pharmaceuticals, and through that process, most of that's really communicated through those subspecialty groups that are out there. And so as it relates to a comprehensive list, I don't know that one exists. I think your point is well taken, that it would be good to know what those lists are. I'm relatively certain that the pharmaceutical companies could easily provide such list if we requested it from them, and I'd be happy to do that, maybe provide it for you. But as you are well aware, there are a plethora of pharmaceutical companies across the United States, and how those coupons are applied, not just for their pharmaceuticals, but also across different states as well.
Well, the other answer to that also would be, Representative Ritchie, that new plans come up, and keeping that list updated, I guess it will be a website. New plans come up, new companies come up, new entities come up. So it'll be a moving target in that sense. Representative Davis, you are recognized.
Thank you, Mr. Chairman. I guess my question is really, why do we need the coupons? Why can't we just have the manufacturers just lower the price that people can afford them to begin with?
Chairman Williams?
Representative Davis, I left my crystal ball in my office, but I'm happy to ask it when I get there. It is a really good question. Obviously, when it comes to pharmaceuticals, there's a lot of research and development costs associated with those drugs. And as she testified earlier, those drugs are pharmaceuticals that, intravenous or otherwise, are constantly changing in the cost to develop those drugs. And so my assumption is that the pharmaceutical companies have the ability to set those prices and move the needle as it relates to each individual one and the market demand for them.
It is a complex marketing model. Did you have a follow-up, Representative Davis? Okay. Representative Ritchie, I'm sorry, I didn't.
No, and I was just going to follow up. Obviously, with new companies coming on the market all the time, and new technology prescriptions that are out there, but they're still getting contracted inside of the state. So that could end up being something to where if there was a overall report or website where once they end up being licensed to be able to provide those medications here in the state of Tennessee, that would be made available as well. So we could certainly, even with the target moving, be able to have a comprehensive list.
Chairman Spicky, you recognize.
Yes, Mr. Chairman, the first question is for you.
Okay.
The people who testified on the bill today, the 4 people who testified, they have to declare whether they were for or against to the chairman. Was the order no, yes, yes, no?
The order was yes, no, yes. Does that
So I had
help?
I had it backwards. Sorry.
Okay.
I had it backwards. Okay,
right.
thank you.
Any
Okay.
other clarification, members?
I
Okay,
have
you have
I
a
have
question also?
Yes, and so I'm voting on the bill. If this is the bill that I understand, currently pharma offers coupons to individuals to get these specialty drugs, and pharma's intent that they use these coupons to help pay their deductible so that they can continue to get these drugs, and the insurance company will pay for them, because that's the deal. The insurance company has a third-party provider that puts the consumer aware of where to get the coupons. If we pass the bill, pharma will still be able to offer the coupons to the individual, but the insureds will not be able to help the consumer find the coupons. Am I right? Is that what we're talking about?
Chairman Williams?
Thank you, Chairman Spicky. Your description of it is correct, but however, at the end of that third-party maximizer, instead of that credit for the coupon going to the patient and the person insured, it's not being applied to their deductible. This would allow it to be applied to their deductible.
Chairman speaking.
And I'm asking a question here, but wasn't testimony that if you use this, there's no deductible?
Chairman Williams.
There may be in some cases that that's the case. I think it's very difficult for those testifying today to be able to communicate on behalf of people who are not here and businesses of which they do business with that they have no tie to. So as it relates to their specific business or who profits from it or how it's spent or what the process is, those maximizers or accumulators would be the ones best to answer that.
Thank you.
Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chair. And I like your bill, but my concern is it's always when we're doing something like this, that unintended consequence that we don't realize we're doing. And what kind of keeps getting in my head is ask about the ERISA plans. And majority of people are on ERISA plans, self-funded plans. So, there's parts to a self-funded plan, and one is going to be the stop loss. And that's a pretty big component of a self-funded plan, the two aspects of the stop loss. I'm just scared that we do this and we think we're doing the right thing, but on the back end, we're saving, the consumer money getting their drugs, but we're going to raise their health care cost because the stop loss is going to be higher for their plans, i.e. make the premium higher. So, there's always somebody going to win. We're trying to do the best we can for consumers. And I know you're trying to do that. And I'm just trying to wonder, which is going to be the best path. But that being said, I hope, I'm going to try to contact somebody before this gets to the floor and just see what that industry says. Thanks.
Chairman Williams.
Thank you, Representative Mitchell. That's a really good question. As you well know, with self-funded plans, there's always a question of whether any statute applies because they're federally organized. And so as it relates to whether it applies to this or a plan or another one, I think that unfortunately is a decision that's made outside these chambers.
Representative Hemmer, you're recognized.
Thank you, Mr. Chairman. Thank you, sponsor. I just wanted to clarify, there's nothing in this legislation that would prohibit a physician or a physician office from signing up patients for these coupons, correct?
That is
Chairman
correct.
Williams.
That is correct.
Okay.
Yep.
And
Follow.
I assume the same about patient advocacy groups as well?
Chairman Williams.
Any patient advocacy group, similar to the one today, can advocate as it relates to what they know about coupons that might be available for their specific advocacy group.
Okay.
Representative Chairman Lafferty.
Thank you, Mr. Chairman. I'm not exactly 100% certain to how to phrase this, but I'm going to try. So a little bit earlier, we passed a bill out of here to essentially do a study about shopping for workers' comp insurance. This is, in my mind, far more complex, far more complicated with a lot more moving parts than shopping for workers' comp insurance. Not asking for a study or anything. We've had a good discussion in here. It's been robust. One of the more robust discussions I think I've witnessed on this committee. The waters are still a little murky in my mind. I don't know if anybody else feels that way, but that's where I'm at. If it's up to the committee, but I would suggest that maybe we roll this one more week. Our subcommittees have started to close. We've got a little bit more time in our day. Our heads are a little bit clearer now without so much clutter. Maybe we can drill down a little bit deeper on this page of notes that I've taken. I can see my colleagues got a page of notes. Maybe we could roll this for a week, let the players involved circle back around with everybody. And let's try, instead of being under the gun of making a decision before the clock strikes 12, maybe we can come back to this with a little bit more information, a little bit more comfort before we cast our votes. I'm just putting that out there for the committee to consider. Thank you, Chairman. So,
Did you have a follow-up?
well, I guess procedurally, would I need to make a motion to do that? In- To, to roll it a week?
Yeah. A technicality is that this is our final calendar, so we will, roll it to the bottom of the calendar or something and meet next week. Would that also have to be in the form of a motion? Okay. Okay. Yeah. Yes.
So. would the-
Follow up?
Would the motion be to roll it to the Hill? If the committee's agreeable.
This is a legitimate motion. Do we have a second? We have a motion and a second. We are voting on rolling this to the heel of the calendar. All those in favor, please say aye. Opposed? No. The noes prevail. So we are back to where we started. Members, do we have any more questions? Seeing none, I think we're just about ready to vote. Without objection, we are voting on House Bill 2170. All those in favor, please say aye. Opposed? The bill moves on to calendar and rules.
Thank you, Chairman and committees.
Chairman, speak if you had a question. We have a few minutes to take up. Do we have Chairman Hurt here? Okay. Item 5 on our agenda is House Bill 2490 by Chairman Hurt. We have a motion and a second, and we don't have any amendments. That's clean bill. Chairman Hurt, tell us about your bill.
Thank you, Mr. Chair and Committee. And Mr. Chair and Committee, bless each of you. I promise my bill is much more simple. House Bill 2490 is Save the Rural Ambulance Act. I think we know that pretty much all of our rural ambulance services are operating at a deficit, and that is caused by the reimbursement rates that have not been updated since 2011. And House Bill 2490 just seeks to update those reimbursement rates to we're not looking for profits. We're just looking for fairness for our rural community. So with that, I think we have some folks available to answer questions if they are, but I'll do the best I can with it also. So thank you, Mr. Chair.
Members, you've heard the explanation. Do you have any questions? Questions been called. Without objection, we are voting on House Bill 2490. All those in favor, please say aye. Opposed? The ayes prevail. The bill moves on to Finance, Ways and Means.
Thank you, Mr. Chair and Committee.
Can we take another one? Let's see. Hale is not here, is he? Oh, okay.
Do I take Terry's out of order real quick?
Members, in the interest of time, we'll take a bill out of order. Chairman Terry, can you present yours? That is House Bill 2374 by Chairman Terry.
Thank you, and I do have an amendment 17205.
We have a motion and a second on the amendment 17205 attaching to House Bill 2374. All those in favor, please say aye. Opposed? The amendment goes on the bill. Chairman Terry, tell us about your amended bill.
All right, thank you. And what this bill basically says is that if a healthcare provider informs an insurer that they will not accept payment via virtual credit card, then the insurer shall not submit any payments via virtual credit card. This is something that we unanimously fixed for dentists earlier this year, and I'm looking to address that for all the other healthcare providers.
Members, do we have questions? Seeing none, without objection, we are voting on House Bill 2374. All those in favor, please say aye.
Aye.
Opposed? The bill moves on to calendar and rules. Thank you.
Thank you, Chairman Committee.
For the record, House Item 7, House Bill 2039 is off notice. And despite a good discussion and a thorough examination of issues, we can claim that we finished in time. Without objection, we stand adjourned. Members, those of you here, we will meet next week to take up the couple of bills left. So kindly put it on your calendar.